Today, health officials are sounding the alarm about measles. Texas seeing the largest outbreak with 124 confirmed cases. The state's health department also saying one child has died. The CDC says this is the country's first measles death in a decade. This has parents nationwide worried. Here in Michigan, we saw several measles cases just last year. Our chief health editor, Dr. Nandi, is here now. And Doc, with this outbreak in Texas, what should parents know about vaccinations?
And Glenn, as a dad, I understand why moms and dads are concerned, right? For anyone everyone not protected, it can really, you have to understand this can cause pneumonia, blindness, seizures, brain swelling, and even death. So what should parents know about the measles vaccine? First off, it's a part of two vaccines, right? MMR and MMRV. MMR protects against measles, mumps, and rubella, while MMRV also includes varicella, better known as chickenpox. However, MMRV is only for kids between 1 and 12 years of age. As for when to get the vaccine, CDC recommends 2 doses of the MMR vaccine for kids, one at 12 to 15 months, another at 4 to 6 years of age. However, it's never too late to get vaccinated. Now, a lot of my patients often ask me what to do if they don't know if they were vaccinated. Here's the general rule. If you're born before 1957, you're likely immune. Born in 1957 or later, the CDC recommends at least 1 dose of MMR if you don't have proof of immunity. In most cases, getting another MMR dose is safe and can help protect you, but it's best to check with your doctor first, of course.
So if a child's already vaccinated, is there an issue there?
Yeah, it's important to understand that, right? So what, and the other thing is that what can babies do, right, to protect themselves? My own kids, Glenda, are vaccinated because I know how effective it is, right? 2 doses provide over a 97% protection. You got to remember that, 97%. So the risk of infection is very low. If they do get infected, they tend to also have a milder illness and are less likely to spread the disease. Now, measles is extremely contagious and can survive in the air for up to 2 hours. In fact, 9 out of 10 people who are not vaccinated will get it if they're near someone that is infected. And people can spread it, Glenda, before they even know they're sick, starting 4 days before you have this telltale rash that can appear and up to 4 days after. That's why the first line of defense is to be vaccinated. As for babies under 12 months of age, right, it's super important to take precautionary steps. Here's what parents can do. If you're in an area that's an outbreak area, talk to your pediatrician. Your baby may be able to get an early dose at 6 months. Also, please limit exposure. Don't go to big crowds and avoid sick people, or consider masking up. Breastfeed if you can. It helps provide antibodies to fight infection. Please practice good hygiene, right? Wash your hands often and keep your baby's environment clean. So, listen, I think that there's a lot that we're talking about, but please get vaccinated, because you talk about these kids who are getting infected and the one who died was not vaccinated.
97%. Wow.
Yeah, it's a big number. Yeah, it's good. Exactly.
Thanks a lot, Doc.
My pleasure, of course.
And if you have a question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X.